Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Welcome to Seven Figure Chiro Podcast. I'm your host, Dr. Jeff Berard. Along with me is Kristin. Welcome, and thanks for joining us on our fourth episode of Seven Figure Chiro. Those of you that have listened before, we have a recap of our prior podcasts. We had a vision of your life in 10 to 20 years, which is important to establish. We talked about getting the right people on the bus and the wrong people off the bus. We discussed the Hedgehog Concept, the three circles, knowing what your passion is, what you're the best in the world at, and what your financial drivers are. And that Venn diagram where those three circles intersect is the sweet spot, and that's your hedgehog. And then lastly, we talked about the BHAG, the big, hairy, audacious goal. What audacious goal have you come up with for your business? Those are four things that were essential for you to establish prior to putting this all into action. And that's what today's episode is all about, is putting it into action. So let us begin. Number one, let's learn. All of our team members have to know very decisively how to communicate your Hedgehog Concept to your community and to patients alike. So you got to understand the how, the what, and the why. And this is important for you and your team to understand intimately so that the community and patients are very clear what your passion is and what you are the best at. So let me give you an example. Chiropractors are pretty good at going out and marketing to the public. So networking and community communication. I did a talk at a nearby city in front of a couple hundred people, and there were some other businesses up there that were doing the same thing, and they'd get up and, hi, my name's so-and-so, and I sell insurance, and I want to help. Great. Well, everyone else sells insurance too. How are you different? So super nice guy, and I'm sure he has all the right intentions, but there was nothing that wanted me to go see him opposed to the person that I currently see. So it's important to be able to articulate that when you're speaking to people is what makes you better, what makes you different. So the second thing is patient communication, right? You need to make it crystal clear to the patients that you are the best at what you are offering, and you expect exceptional results for those who commit and comply with your recommendation. I'm going to give you an example I wrote down here for this, just if someone were to ask me the question, how I'd answer it so the listeners get a feel for what that sounds like. So an example of how I communicate our Hedgehog to the community and patients is simple, and it differentiates us from others. So let me share with you what I wrote down. And this is kind of what I said at that meeting in front of a couple hundred people. So our whole concept is we render a unique care model that is utilized by most of the elite professional sports organizations around the world. We combine care rendered by chiropractors and physical therapists who provide general physical therapy and chiropractic care with a specialization in treating sports-related injuries. Combining physical therapy and chiropractic care provides exceptional outcomes. This is why you'll see the treatment model in the NFL, NBA, MLB, and U.S. Olympics, and every other professional sporting organization, because the results are exceptional. And MSR believes everyone deserves the same level of care that provides to the elite. So, that's a little different than saying, oh, I'm a chiropractor. Well, there's a lot of chiropractors out there. There's no differentiation of what makes you better. So what sets us apart is our MSR method, where we provide the same level of care that elite athletes get. And we believe everyone should get that same level. Our Hedgehog Concept is combining physical therapy with chiropractic in combination because the results are just better. So that's very simply what makes us different. So those of you listeners have to come up with a way to explain your Hedgehog Concept to those that are seeking your care, so you can set yourself apart from just the ordinary chiropractor.
But you also have to understand it, and you have to be great at it too, right?
Well, yeah, you have to deliver. And at the end of the day, I mean, listen, it goes without being said. What you say you're going to do, you have to do. You have to deliver. And I started episode 1 with just that is, listen, we're not here to tell you how to practice the technical component. You went to school. That's up to you as a provider to make sure you hone that in to a very, very, very high level. That goes without being said. So all these things I'm talking about, we're not going to talk about the technical aspect of providing the service. That's for you to go into. That's way too much time, way too much structure to get into that. And that's something that most of you already have or are developing. So that goes without being said. So please figure out how, in a clear, concise fashion, how to articulate that hedgehog to your patient's community. I'll give you a little example of how I handle patients. When a patient comes into my office, I'm sure all of you have encountered this same thing. Oh, I went to another chiropractor, it didn't help. I went to a physical therapist, it didn't work. I still have the problem. Well, listen, Kristin, here we do things a little different. We have a very unique treatment model that, if recommendations are followed, does produce exceptional results, and that's why we've had the success we've had today. So I appreciate you being here. What I do ask of you is that if you truly want to recover from your reason of being here, that you follow our recommendations, because we do, and you should too, expect exceptional results. And then I'll just go into my exam, and when I'm done with my recommendation, that's when I kind of put the cap on our Hedgehog Concept is, Kristin, here, I know you've tried physical therapy and chiropractic, but unfortunately you haven't had them both at the same time. And I believe our philosophy here is that's a missing link. They both do great work, but they're better together. And that's what we're going to provide for you. Do you understand? Good, great. Boom, it's done. So number 1, articulate your Hedgehog Concept. Make sure all your team members who go out into the public, who talk on the phone, who talk to patients, who talk to clients, have the same message and are very crystal clear about that. Number 2, so again, we're putting this into action. You know how to communicate your Hedgehog Concept. You have to construct treatment plan models that support your Hedgehog Concept and your goals. When I first started practice, I was just flying at the seat of my pants, and I'd give patients whatever they needed without any structure to treatment plans, not knowing what our metrics were, not knowing what our financial drivers were. And most chiropractors do that. They just kind of fly at the seat of their pants. You need to construct, you read the websites of chiropractors, and we deliver customized treatment plans and all that. And that's great. And you should. However, you can have a set number of custom treatment plans that the majority of the public falls into. So construct treatment plan models that support your Hedgehog Concept and your BHAG, right? Your big goal. Every successful clinic, no matter the profession, chiropractic, medical doctors, dermatologists, plastic surgeons, even a shoe store, right? They all know their financial drivers, and they have products that they push. So you have to know your financial drivers, and the recommendations incorporate those services. You need to devise treatment plans that most people fall into, that are evidence-based and meet the objective, the presenting problems and your financial drivers. So not having these treatment models will prevent you from predicting growth. They'll prevent you from predicting your financial forecast and how and when to scale staff. So it's important that you construct these treatment models so you can forecast the trajectory of your business. So again, this is imperative to scale your business financially. Kristin, let me talk a little bit about how we do that. Okay, how we model our treatments. So, over the course of years, I see, and I'm sure the listeners too, you see most people fall into certain categories, right? Neck pain, low back pain, there's headaches, there's disc problems, there's a handful of, maybe 10 things that most people come in to see you for. Well, there you go. There's your foundation to create those treatment models or the treatment plans. So when most people come into our clinic, we give a clinical diagnosis. Okay, so if someone comes in their pain, they have a clinical diagnosis, let's say it's Facet syndrome, and then we give them also a functional diagnosis of lower or upper cross syndrome. So the clinical diagnosis, we give them, it's usually an acute recommendation. We get them out of pain quickly. And then we have their functional diagnosis, and this is where a Hedgehog Concept comes in, where we make corrections for their functional diagnosis. And this usually requires care outside of acute care. 2 visits to 6 visits of acute care is great, gets them out of pain. But if they want to treat their functional diagnosis, it requires a little longer. We go maybe 6 weeks. We typically don't go longer than 6 weeks of treating their functional diagnosis. That's composed of a typical treatment model 3 times a week for 2 weeks. If they're super acute, we'll see them daily for 2 or 3 days. Then once they're out of that phase, we go 3x2, where we do we get some manual therapists involved. The chiropractor adjusts them. They get a little bit of stretching. Once they're out of their pain and they kind of feel pretty good, then we can tap into their functional diagnosis, where they'll see the chiropractor and then they'll go see the physical therapist on the same day. If you don't have a physical therapist, most don't, well, there's things that you can do. There's things that you can hire people to do. We have a stretch center in our office, and we incorporate that into our treatment plans. Patients see me twice a week. After I adjust them, they go see the stretch therapist, and they go through 30 minutes of therapeutic exercise and assisted stretching. Patients love it. They get amazing results, and it addresses their functional diagnosis. And that pretty much caps at about 18 visit protocol. We know how much that costs us. We know what our cost is to treat. We know what we make on those treatment plans. So we know what to pay those that are servicing us, and we know what our profit margin is. So by establishing these treatment plans, this will provide you your cost to provide the service. There's time involved. Sometimes you're delegating services to other team members who you have to pay. You're using products that cost you money during treatment, certain tape. Maybe you do dry needling, you got to use needles. Some people have lasers and all these expensive pieces of equipment. You got to pay for that. So you need to understand your cost of the treatment so you can come up with a reasonable fee so you can make money. You have to make money to run your business. Setting these treatment plans also provides you with a financial forecast. I'll give you an example. If the treatment cost you X, then you know what to charge to hit your expected return on that service or visit. Knowing your profit margin on a service gives you control to how to scale your business. Knowing the information gives you exactly what the business needs to hit your financial goals. It tells you how many patients you need to hit your financial goals, how many team members you need, how to schedule appropriately, right? It allows you to do so many things in an organized fashion if you know exactly what you're going to do on patients. So you need to construct those treatment models. There's going to be some people that fall outside of there, of course. You get some people, I just want to get adjustment and get out of here. Okay, great. There's going to be plenty of those. There's going to be people that don't comply. There's going to be all these other random, but the majority of your clients will fall into a category that you can control the outcomes. You can control the financial forecast. You can control the numbers, your key performance indicators. So it's important to construct your treatment models. You might have 3 or 4. You might have half a dozen, who knows? But usually there's just a couple staple treatment models that most people fall into. We have a decompression protocol. We have an acute protocol. We have the functional diagnosis protocol I just alluded to. That's where most people fall into. That gives us 18 visits, a patient visit average of 18. We know exactly what we're making on every patient that completes that protocol. So I told you we address the acute care in 1 to 5 days. Then we transition to treating their functional diagnosis 3x2 and then 2x6. So the 3x2, they incorporate manual therapy and an adjustment. And then once they're done with that, they divorce the manual therapy. We're done with the tissue repair phase. Then we go into the functional diagnosis, an adjustment, and then they get some therapeutic exercise. We personally build 2 units of therapeutic exercise, and they get assisted stretching, and we do some exercises to reinforce what we've done. So there's nothing more important to establish this once you've developed those other topics we discussed in the first 3 episodes. So please go through, make sure you establish how you're going to communicate your Hedgehog model to your community and your patients alike. Establish those treatment models. Know the numbers on those treatment models. Know what it costs you so you can know exactly what to charge to provide the profit margin that your business needs and that you want to hit your goal. Once you have those, now you're off to the races. Now you just need to get asses in the seats and get people on those plans and produce what you say you're going to produce, which we know you will. So this is a very important step to follow on our next. Before we conclude, I want to make sure that we have all the nuts and bolts for these 2 topics. I know it's kind of a short episode, but our next episode, we're going to talk about providing standard operating procedures for all this stuff. And then it will start to get fun once you have this foundational stuff. Is there anything you would like to comment on with these treatment models, since you do our metrics and our numbers. How helpful is it for you knowing when you do all the spreadsheets and you know what treatment models we are, how many times we should see a patient, you do all the hiring, you decide what compensation people to have. And the reason why you do that is because you know what our treatment model is and what the cost is and what our return is, correct?
Yeah. So what we do when we're starting to come up with, the different pieces of our Hedgehog concept and making plans year by year when we have these different programs and these different treatment models is, first, we have to look at what do we know, what is best for the patient, what does research say. So, talking about those things from a clinical side of things, then kind of working backwards, because obviously we want what's in the best interest of the patient, and then we develop treatment models and then kind of go from there. So once we've talked about what patients need in our specific clinical setting, and then talk about the treatment models that will be best for the patient to get better faster and long term. And then we kind of go backwards with how much is that treatment model going to cost us, and then how much is it going to bring in as far as income goes. Now, I will say that because we've been in practice and we've kind of grown over the past 10 to 11 years and then owned clinics before that, we have a good foundation and understand how these treatment models work with patients. And then we have the statistics on, how many people drop off, what is our usual patient visit average, what is our office visit average as far as how much do we bill out compared to how much comes in. And so that helps us understand those things. And then we can kind of break down what team members do we need to do what, and then grow from there, because you don't want to have too many team members in your clinic setting and they're just sitting around and they're not doing anything. So each person, you want to have a purpose, because obviously you want to get the right people in your clinic, paying them a great salary or a great hourly wage. And that's what's going to keep people coming back, because they're getting the care that they need. So there is a difference. And I will say, if you are starting a new business, it's a little bit harder with statistics, because I believe a lot of people who are starting new businesses overcompensate, and they think that things are going to be a lot better than sometimes they are, or maybe it takes a lot longer to take off than you had originally planned. So these are things that you have to think about. So you only want to have the minimum number of team members in order to execute those treatment plans necessary based on the number of new patients that you have coming in. So it does look like, and we'll talk about a lot of this as we continue with episodes, starting a new clinic is a lot more work on the owner's part than it is as you continue to grow. You have more team members that can help out do those different things to help you grow. And then one other thing I wanted to touch on is, you mentioned employees delivering the message to patients that are coming in and then also out in the community. And I highly recommend that when you are interviewing people, so you're bringing new people on board, you talk about your Hedgehog concept and then what the treatment plans look like. And then also having employee or team member meetings on a weekly and monthly basis. It gives you opportunity to continually talk about your Hedgehog concept and the treatment plans, talking about what's working and what's not working. And then it gives you an opportunity to let them know what the updated statistics are within your clinic. So like patient visit numbers and collection numbers and expense numbers, because it is important that employees know at least the most basic statistics so they understand how they can help make things better, not only just for the patient, but for the business, so that they can grow as well. And then when you have new employees, it's a great idea to role play with them and practice with them as well, because you want to make sure that they're delivering the message out to the community and to your patients that you want people to know about your business. So role playing, it's not stupid. It's actually very, very beneficial, and it makes sure that people understand what they're talking about and feel confident about it as well.
Yeah, so Kristin brought up a good point, and this again goes without being said. We don't construct treatment models that we want patients to have. Just over the years and experience, we know what patients need, and we've developed our financial drivers around that. So again, that goes without being said. We don't push everyone into a corner and this is what you get. Over the years, we just know, and I'm sure those listeners, those chiropractors out there also know where the majority of the people fall, and you can construct these very innovative treatment plans that provide exceptional results and provide you some nice returns, which that's one of the reasons you're in business for. So that concludes this episode. Again, let's communicate that Hedgehog concept to the community and make sure your team members understand it well, and let's communicate that Hedgehog to your clients and patients. We don't go out plan to fail, we fail to plan, those that fail. So this is to prevent that from happening. So please put together a plan, know exactly how you're going to say it, what you're going to do, and why you're going to do it. Until next episode, I'm your host, Dr. Jeff, along with Kristin, and keep up the good fight.
Bye.
Thanks for tuning in to this episode of Seven Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a seven-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.